My name is Dr. Earl Reichert, and I'm the CEO and Clinical Director of Archstone Recovery Center in Lantana, Florida. At Archstone, we pride ourselves on providing quality and individualized treatment for our clients. We treat the whole person, not just the addiction. One of the ways we accomplish this is by having a strong relapse prevention program for our clients. I would like to discuss the importance of relapse prevention in providing individualized substance abuse services. For years, dependency was considered a lack of willpower, and alcoholics and addicts were considered bums or deviants who chose to use instead of working and doing the things that were accepted as normal in society. Even counseling professionals considered substance abuse and dependency a symptom of another mental illness. Unfortunately, many professionals still maintain this belief. It was this stigma that led to Bill W. and Dr. Bob forming Alcoholics Anonymous. 4 years after the forming of AA, most chemical dependency counselors consisted of recovering addicts and alcoholics. This approach was highly successful with clients limited to substance-related disorders. The problem was, as it is today, many alcoholics and addicts failed to maintain sobriety. A large part of this failure was due to the counselor's lack of knowledge in how other disorders affected recovery, how these disorders would pressure the client into relapse. Today, many clients are identified as dual diagnosed upon admission for substance abuse treatment. Most providers explore these disorders as triggers that can lead to a relapse. By providing relapse prevention to basic chemical dependency treatment and setting up appropriate referrals, today clients have a greater chance of gaining sustained recovery. When a client enters treatment at Archstone Recovery Center, we complete a full drug history and psychosocial assessment. This allows us to determine the severity of a client's substance abuse problem and the individual developmental factors that will affect treatment. We assess the client in 5 developmental areas: cognitive, physical, emotional, social, and spiritual development. Cognitive and physical areas focus on the client's mental and physical stability to participate and complete treatment in our program. Many clients suffer from biological or organic disorders that require medication. Clients historically have high rates of clinical depression, bipolar, and other clinical disorders. At Archstone, we assess and treat these clients. Our team of professionals, which include licensed mental health counselors, certified addiction counselors, medical staff that include an RN and an APRN, psychiatrists, we do complete evaluations on the client as a whole. Clients receive medical services and education on their disorder. We teach the clients how to deal with their illness and their chemical dependency so they can live a long, happy, sober life. The other developmental areas we assess are emotional, social, and spiritual. These areas are usually affected by problems in growth. These are the mental illnesses caused by thought disturbances or beliefs. Although medication may help these symptoms, these issues require counseling to address the root cause. I developed what I like to call my Nintendo theory. One day I watched my wife and my son play Donkey Kong on a Nintendo. And as you run up the stairs, the big monkey throws a barrel and whacks you in the head. Well, level 2, they throw 2 barrels. Level 3, they throw 3 barrels, and so on. At the end of the day, my wife had reached level 6 and my son had completed the game. When I watched my wife play after that, I noticed that she never made any progress off of level 6. Later, I realized that when she got stuck on level 1, my son had helped her. And on level 2, he helped her, and he assisted her to get to level 6. So the problem was, although she was at level 6, she never acquired the skills to get there and lacked the skills to continue on movement. That's sort of how it works with human development. Let me give you an example of how this works in a client that I had several years ago. This client was a 21-year-old male who grew up in a family of chemical dependency. He had learned from an early age to deal with emotional problems and social problems by using alcohol and marijuana. Also, due to abandonment issues from his parents, he had developed dependent personality disorder. After entering treatment at 21, and the client was really motivated to get sober, his girlfriend wrote him a letter, and the girlfriend broke up with him, wishing him good luck in treatment but ending the relationship. 2 days later, the client left treatment and relapsed. Now, many of the counselors said that this client chose to use, and that may be true. But the problem is that this client didn't have the developmental growth to deal with this issue as a 21-year-old. Due to his use of substances most of his life, he had the emotional skills of a 10-year-old. And although that crisis may not make somebody relapse that had skills, to this client, this was an overwhelming crisis. In conclusion, I just want to say, having been a substance abuse counselor for the past 30 years, that times are changing. Years ago, you'd treat the pure alcoholic, you'd treat the pure drug addict, you would bring them into treatment, you would teach them about the disease, hook them up with AA and a sponsor, and they would do well. Times have changed, and counselors and treatment centers need to change with that. Nowadays, our clients are multi-drug users and have dual disorders. So as counselors, we have to be comprehensive in providing services. We have to understand chemical dependency, and that will always be the primary for treatment. But we have to have a working knowledge of other mental illnesses so that we can develop treatment plans that give the client a chance for success. Again, I'm Dr. Earl Reichert at Archstone Recovery Center. Thank you.